Hello, I'm Rabina and I'm here to give presentation about human dignity in healthcare. Let's talk about human dignity first. Human dignity is an inherent value of a human being. Every human being is born with human dignity. It is universal and unconditional. There are two types of human dignity. Every human being has inherent dignity simply by being born, which cannot be taken away. For example, a person in a coma or a newborn child has dignity and deserves respectful care while also protecting their autonomy and ensuring comfort and privacy. And the next one is attributed dignity. It is variable and depends upon the social circumstances and behaviors. For example, a patient with a mental health condition is laughed at by hospital staff for talking to themselves. They are not addressed directly and decisions about their care are made without their input. In this case, the patient is being stripped of their attributed dignity. Staff are treating them as less deserving of respect and autonomy because of their condition. Human dignity in healthcare ethics. Inherent dignity is the foundation of healthcare. As Linda and Lone highlighted, human dignity forms the core of the ethical healthcare practices. Other concepts like privacy ensures that a patient's personal information and autonomy are respected, allowing them to maintain control over their own life. Next one is veracity. As Emma described, it preserves dignity by allowing patients to make informed decisions based on accurate information, while futility relates to ethical consideration of providing care, and it upholds dignity by preventing unnecessary suffering and respecting the patient's wishes. We see dignity reflected in the bioethical principles of autonomy, where healthcare professionals respect the patient's right to make their own decisions. It also aligns with justice, ensuring that all patients receive fair and equal treatment regardless of their background. Deontology, or duty-based ethical theory, emphasizes our responsibility to respect and treat patients with dignity at all times. Virtue ethics teaches the healthcare professionals should show virtues like compassion, empathy, and integrity. These qualities are important for respecting and maintaining a patient's dignity. In nursing, human dignity is more than just a value. It is a guiding principle for how we deliver care. It underpins ethical practices and is embedded in our professional obligations. When nurses respect dignity, we build trust and develop therapeutic, respectful relationship with patients. This includes listening to patients' needs, respecting their decision, and treating them as whole persons. Cultural safety is another important aspect. By honoring a person's background and beliefs, nurses provide inclusive and person-centered care. Dignity is also closely connected to autonomy, allowing patients to make informed decisions about their care and supporting those decisions, even if they differ from our personal beliefs. Lastly, when dignity is upheld, it prevents neglect, bias, and discrimination, particularly in high-pressure or understaffed environments. In nursing, human dignity is a foundational ethical principle that shapes every aspect of our professional conduct. The RMBA Code of Conduct states that nurses must respect the dignity, culture, values, and rights of all people. The RN Standard for Practice, Standard 1, requires nurses to think critically and act ethically, always considering the value of the person they are caring for. Similarly, Standard 2, Registered Nurse Standard for Practice, nurses engage in professional and therapeutic relationships, showing respect and preserving dignity. The ICN Code of Ethics 2021 frames dignity as a core value in nursing, encouraging nurses to promote justice, compassion, and respect. When a patient's decision appears to go against our best judgment, ethical dilemmas frequently surface. For instance, a patient experiencing pain can decline to use analgesic due to personal, cultural, or religious beliefs. This might be challenging for nurses as our goal is to alleviate pain. From a deontological perspective, even if patient declines to take the analgesic, the patient's autonomy and dignity must be respected even if we don't agree. However, a utilitarian view would focus on the consequences, aiming to reduce overall suffering even if that means overriding the patient's immediate choice. This is where pluralism becomes important, recognizing that dignity can be understood differently in different contexts. The nurse's challenge is to balance advocacy, compassion, and respect even in complex situations. In conclusion, human dignity is not optional. It is foundational to ethical, safe, and compassionate nursing care. It connects with ethical principles like autonomy and justice and is deeply embedded in our professional standards and codes of conduct. In real-world nursing, upholding dignity can be challenging, especially when the practice refuse care or when cultural values differ. But as a nurse, we have responsibility to reflect ethically, advocate respectfully, and care with compassion. When we honor dignity, we don't just follow rules, we approach the heart of what it means to be a nurse. Thank you. And here are the references list for my presentation. Thank you.